Thanks so much, Dr. Bansi, Dr. Sadikot, and friends. I think I'm going to be very brief because this is a very common sense prescription. And I think I was quite impressed by the previous speakers who said that ultimately, in spite of the guidelines and all the stuff that we talk, what is ultimately important is a common sense medicine. All these conferences come, go, we scratch each other's backs. And in the end, most of the audience is in confusion. So let me tell you one thing, this is a age-old remedy. Sleep and the health. Sleep is a golden link between the health and rest. It's a physiological process, it's a biological process. It gives rest, relief of tiredness, restoration of our body, re-energizes, conservation of energy, and restoration of a cognitive thinking ability. It decreases CNS activity, it decreases CVS activity, and decrease in BP and heart rate. It decreases respiratory rate and metabolic needs. Obviously, changes in the sleep in the different body systems is the central nervous system, cardiovascular system, which is most important, respiratory system, GI, endocrine, and renal. It's a triumvirate of the health, sleep, nutrition, and physical fitness. And sleeping with someone is optional. Sleeping alone is more energizing. In fact, they recommend that if you really want to get up fresh, husband and wife or the spouse, because today is very difficult to say husband and wife, you should sleep separately. They should sleep in two different rooms. Then only sleep has more beneficial effect. Sleep requirements, very important. Infants and children sleep 18 hours, 16 to 18 hours. Teenagers, 9 to 10, but this is changing now. Mature adults, 7 to 9 hours. Now the trends are very, very alarmingly changing. I know teenagers who sleep for 4 hours. I don't know what they do whole night. The average amount of sleep what we get today is decreased over a period of time in last 50 years. In 60, average amount was 8.5 hours. Obviously, there was nothing like TV and things like this. I think we are wasting too much time watching TV. 2002, average 7 hours. In 2004, as per National American Health Survey, 1 in every 3 adult, men and women, slept less than 6 hours per night. And it's fashionable not to sleep more. Obviously, stages of sleep are very important. Sleep structure is composed of 2. You all remember this. Non-rapid eye movement, rapid eye movement. When you go to bed, the stage from full alertness to early drowsiness is called the stage of wakefulness. At the beginning of the sleep, sleeper fluctuates between stage W and the stage N1. After stage W, the sleeper begins with non-rapid eye movement, sleep stages 1, 2, 3. Which is followed by rapid eye movement. That's the time when we dream, and it comes in a cycle. So this is a cycle. Obviously, N1, N2, N3 have 3 different functions which are very, very important. However, as the people age, the stage N3 decreases, and because of the restorative physiological process that occurs during N3, many of your adult patients or senior patients will tell you that, sir, in spite of sleeping for almost 6 to 7 hours, turning and tossing, I never feel fresh in the morning. Now, this is a very important thing that you should know. Rapid eye movement sleep is very important. Most of the dreams take place during this stage. Heart rate and breathing becomes more irregular. And this is the effect of sleep on heart. And many of the times you will see the heart attacks. Atrial fibrillation, dysrhythmias occur in this sleep. It occurs roughly 90 minutes and progressively increases in duration. Occurs after stage 3 in the first part of the night and occasionally after N2. A lot of people skip N3. First cycle lasts approximately 10 minutes and progress up to 25 minutes, and this cycle keeps on changing. What causes sleep? Sleep-wake cycle, driven by circadian clock, runs on 24-hour cycle and responds to light and dark. You tend to sleep when it's dark and you are awake when there is a light. Sleep drive, there is something known as sleep drive. Result of circadian rhythm, maximal sleepiness occurs in the early hours of morning, affected during the wakefulness and duration of the quality, last sleep for 1 hour for every 2 hours that the person is awake. There is something known as sleep debt. You don't sleep for 4 or 5 days in a row, one day you catch up and you sleep for a long time, and that is again physiological. Now it's very important to know how big people also can make mistake. Judith Kinfold's studies show sleep really does make you smarter. Now this is very important. According to Robert Steve Goals, the Harvard medical professor, the advice to sleep on it, what we use it, because when you sleep, you get up smarter. And I see that very often when I give this talk to the audience, they really follow it seriously. And that's largely you'll see many of the people who will see in the first row dozing off. You ask them at the end of the session, they will answer better questions than the people who are wide awake when there's a program like back-to-back, some 100 lectures. And I think that is very important. Want to be more productive? Sleep on it. More sleep could help turn grades around. If the children sleep well, their performance in the school improves. Sleep helps people learn complicated tasks. How much do you really need to sleep? Varies between people. There are some people who have a genetically short sleep gene. Our late Prime Minister Indira Gandhi was like that. She would sleep only for 4 hours. And that's amazing that she could be restored, and of course she was deeply in yogas. Most studies examining the relationship between sleep length and disease suggest between 7 to 8 hours is optimum. Now what are the effects of sleep deprivation? We are studying the sleep as a prescription. Deficiencies, alertness and attentiveness, increase the irritability, lethargy and other mood problems, lack of concentration and judgment, difficulty in conducting simple tasks, decline productivity, higher risk of developing anxiety, depression and coronary artery disease, lack of control over sleepiness and morning headaches. In children, poor learnness, weight gain, obesity and hypertension. Now this is what concerns us. Consequence of sleep deprivation. What happens when we don't sleep enough? Traffic accidents, occupational risk, and most important, health-related risk. One of them is obesity, cardiovascular disease, and type 2 diabetes. Sleep duration and weight gain 15 years. Women who slept 5 hours or less were 32% more obese. Sleep duration and incidence of obesity in adults, there is a clear-cut relationship. Adults who sleep less than 5 hours per night have 60% chances in risk of obesity compared to adults who slept well. How might sleep affect well? There are many theories. Alteration in glucose metabolism, alteration in hormone secretion, causing an upregulation of appetite and decreased energy expenditure. Sleep deprivation and metabolic functions. Some of the background that we will study now. What interferes with the sleep is the circadian rhythm, jet lag, shift work, temperature, not comfortable temperature, drug ingestion, and please remember alcohol On a long-term basis, alcohol is a very bad drug for inducing sleep and of course sleep disorders. What concerns us today, which is a very common problem, is the sleep disorders, and one of them is sleep disordered breathing. That is what I am going to focus on. The non-REM parasmias, periodic limb movements syndromes, restless leg syndrome, night tremors, and bruxism, very common. And REM parasomnias are REM behavioral disorders and nightmares. Now, what is obstructive sleep apnea? This is what we talk very often, many times loosely. Sleep disorders characterized by recurrent episodes of narrowing or collapse of the pharyngeal airway during sleep despite ongoing breathing efforts. This often leads to CO2 rise and O2 falls because there is no inflow, no gas exchange, surges of sympathetic activation, leading to heart rate rise and BP at the end of arousal, and periodic arousal from sleep leads to fragmented sleep and can precipitate atrial fibrillation. Prevalence of obstructive sleep apnea is very, very common. Please remember, high index of suspicion is very important when you are diagnosing it. OSA affects large number of people. 24% of men and 90% of women between 30 and 60 with a BMI 25 to 28 have obstructive sleep apnea or AHI more than 5. Anything more than 15, AHI is apnea hypopnea index, more than 15 is a person is called to have obstructive sleep apnea. What happens? Patient who's got a thick palate and a thick passage, due to drop in sympathetic tone, the muscles relax, and actually this is what happens in an obstructive sleep apnea patients. The air is obstructed. You'll see that the air doesn't pass easily, consequence of which the OSA patients either have a thick palate, thick tongue, thick intrapharyngeal muscles, which fall due to sympathetic tone drop in the sleep, and they develop obstruction. And therefore, what leads to occlusion or collapse is this soft tissues which lose the tone and they cause inflow obstruction. Now you'll realize, so what is OSA? Is an episode of complete or a partial collapse of airway, are recorded as apnea and hypopnea per hour. Apnea is reduction of inflow of air more than 90% for 10 seconds or more, which are obstructive, central and mixed. All three could be present in type 2 diabetes. All three. Central is the brain does not signal the body to breathe. Consequently, there is no airflow, while the mixed is both obstructive as well as central. Now, how do you measure it? You have an apnea link machine. You do three-way studies, brain waves, oxygen saturation, and the extent at which the oxygen is delivered. Anything more than 15 is considered apnea. And that's how you diagnose it. What are the risk factors where you diagnose them? Male, overweight, BMI more than 30, advanced age, neck size 17 inches or greater. Now this I don't agree. This I don't agree largely because the neck size could be greater in people who practice Indian classical music. And Pandit Bhimsen Joshi had a neck girth of 21 inches. But these are all muscles. They're all muscles which he had done by Riyaz for the 50 years of his life. So it's not, but if the neck girth is predominantly due to fat and not due to muscle, then the person may have. Family history of OSA, smoking, excessive alcohol use or sedative use. Signs and symptoms, hypertension, non-dippers in the night, the BP does not fall, type 2 diabetes, heart disease, nocturnal arrhythmias, snoring, excessive daytime sleeping, restless sleep, heavy sweating during sleep, nocturnal choking, impaired concentration, morning headaches, impotence, and mood swings. If anybody has these symptoms, you have to look for that. Consequences, personal sleepiness, depression and memory problems. impact on family and friends. Snoring can be a reason for divorce. Please remember that. Economic consequences and occupational health. Perioperative risk is very high with obstructive sleep apnea. We put a CPAP machine on these patients prior to surgery. Traffic accidents, independent risk factor for hypertension. Please remember resistant hypertension. The drugs are not responding. These are the people one should rule out obstructive sleep apnea. Now, OSA and comorbidities, this is a take home. Drug-resistant hypertension, obesity, congestive cardiac failure, pacemakers not functioning well, atrial fibrillation, diabetes, all hypertension and coronary disease. These are comorbidities with obstructive sleep apnea. And this is the rough pathophysiology in which multiple risk factors are operative: catecholamines, cortisol, leptin, tumor necrosis factor alpha, interleukin 6, and they all play a role because of lack of sleep. Now, glycemic control and CPAP actually improves when a patient is put on CPAP, is a continuous pressure delivery. CPAP improves insulin sensitivity and also insulin resistance to a large extent. You'll realize that CPAP improves fasting blood glucose. It also improves many other functions. Now, IDF has recognized this task force recommendation. Patients presenting either sleep apnea or diabetes should be evaluated for the other conditions. There should be a low threshold for reference to establish the diagnosis of sleep apnea. Continuous positive airway pressure is a treatment of choice. You must diagnose with a polysomnography, polygraphy, and home sleep test. Treatment is medical, dental, or surgical, where the soft tissue has to be surgically removed. Skeletal bariatric surgery is one of the important ways of treating it. Treatment consists fixed CAP or automatic positive airway pressure, which has a positive role in management of sleep disorder breathing. And I'm sure it's a common experience that the problem difficult at night is resolved in the morning after a committee of sleep has worked on it. So sleep is a nature's greatest gift to man, and one should be able to sleep well, and that can really prevent many of the illnesses that I have said. Now, obviously, the time allotted to me was 15 minutes, and I have a habit of finishing 4 minutes earlier. So, if you have any questions, because it's very, very important, I'm telling you, in next 5 years, all of you will be talking about sleep apnea, because if you really go into detailed history of this, many of your patients will have history of sleep apnea. Thank you very much.